Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and we're here again. And I just wanted to say thank you to Justin for doing the Friday Focus last week. I know he gave you a good talk about insignia treatment and how insignia treatment can reduce the time that you are in treatment. And so what I wanted to do today is I kind of wanted to go back to this conversation that we were having a couple weeks ago regarding orthodontic treatment and versus cosmetic dentistry. And one of the things I wanted to talk about was this question that always comes up in orthodontic treatment, and it's when someone has a lot of crowding, and that's where they don't have enough space for all their teeth. The question that always arises is whether the question, should we have teeth pulled, adult teeth pulled, to make room for the teeth? And so one of the things that we're really passionate about in the office here is we tell people this all the time, that we'd like to do non-extraction orthodontic treatment. And in doing non-extraction orthodontic treatment, that means simply we try to minimize or reduce the probability or the likelihood that we need to pull teeth out in order to make space for all the teeth. And one of the reasons that we're really adamant about this is because we know that orthodontic treatment, one of the things that it allows for that's a little different than just doing cosmetic dentistry or veneers, is we know that we can influence the facial features of our patients when we do orthodontic treatment. And one of the things that I want to be clear about is this question about extraction therapy or non-extraction therapy. And so what I wanted to do today was talk about a particular scenario. And so these are two twin sisters, and I've talked about this before in the past, and I might even show this example in a previous Friday Focus, but I kind of want to bring this up. Is here are two twin sisters. The only difference that's going to happen in an orthodontic treatment is one's going to have teeth taken out to make space for all the teeth, and one is not. And so this is what they look like before they start treatment. And so one of the things that we want to look at is just look at the nice facial balance between the two sisters. The way the nose, the upper lip, and everything kind of fits together for both of them. And so next thing that we want to do is look at their facial profiles, how they look like from the side. And see, I had this conversation yesterday with a dad. I know that when you bring a patient in, whether it be, and especially when you bring your kids in, the thing that we want to do is we want to make sure that we do everything in our powers, not only to give your children straight teeth, but we want to make sure that we are doing what's right. And I know that, like I was speaking to a dad yesterday, I was like, you're entrusted in me to make your daughter look better than she did before walking into my office. And he goes, yep, it's absolutely correct. And I said, yep. And so I said to him, I was like, look, his daughter had a lot of crowding. She was 8 years old, and I said, okay, I said the same message to him. I said, okay, we got to create space so that in the future I don't need to have teeth taken out. And then I showed him the consequences. Now let's go to let's talk about this. So this is after the girls have had their braces, and you now have to distinguish or determine which of the two had teeth pulled. And so when you look here, when you look at someone from the front, it doesn't necessarily make a big impact. Now, when you look at them from the sides, this is where it all changes. And you can see, so like one of our goals, right, and I'm just going to talk about is, one of our goals is if I draw a dot between the nose and the chin, I put putting this toothpaste holder here a little bit. But what I want is, I want the upper lip and lower lip to be as close to the edge of this box. And so if you go and look here, you can see that what happened when the 4 teeth were pulled out on her upper lip got pushed inward and her lower lip, and so it moves away. And so like I said to the dad yesterday, she's going to end up aging faster, because we know that as she gets older, her nose and her chin get bigger, because that's just aging. So we believe that keeping the upper lip and lower lip as close to that line as possible is the ultimate goal. And so what we want to do is just minimize the opportunity, or minimize the probability that you need to have teeth taken out. And the reason is like the thing that I always say about this, the number of teeth that you have as an adult and the position of those teeth make a difference in the facial outcome of the people that we serve. And so because of that, we're really adamant about making sure that we put ourselves or secure or increase the likelihood that your children, at least in our office, won't need to have adult teeth pulled. And now I'll get a swarm of doctors who will tell me that extraction therapy works, and I totally, I've done extraction therapy, and I said it's not that, there's nothing wrong with it. It just produces a different type of aesthetics. And because it produces a different facial result, I'm just one who believes that I like this more than I like that. And so that's one of the things that you have to start to look at when you're distinguishing between the treatment modalities or treatment approaches that you're being presented. And so I just wanted to bring that to the forefront. So the message here is that should you extract, there's cases where you definitely need to, absolutely. But in our office, we're going to try to mitigate that need. We're going to do everything in our power. Sometimes we do orthodontic treatment in 2 stages, a part 1 and a part 2, to avoid the need or reduce the risk of needing. And so that's one of the, you just got to understand that that's our approach. So should you extract teeth? The answer is case by case basis. I mean, if your kid came around the corner and the first thing that you saw was his teeth protruding out, then maybe I could have an argument that taking teeth out is warranted. But in just the normal everyday question of if you have crowding, should you pull teeth to create space, I would probably tend to try to mitigate from happening. Okay? Again, the most important thing is our facial outcome. Having straight teeth is important. Having straight teeth plus a healthy bite plus looking good is what we're out to achieve here at E&S Orthodontics. And so going back to our orthodontic treatment where we do orthodontics and restorative, this is an impact where orthodontically we can make a great difference for people who have profiles that are a little bit flat, and we want to make them a little fuller, and so that's what we're up to. Okay, if you have any questions, please feel free to call our team members. Any of our team members can talk to you about what we're up to. You can call and ask me, email me, whatever you like. Well, have a great weekend, and I hope you enjoyed this little segment, and then we'll see you back next week at the Friday Focus.